Continuing wrapping up our discussion on glaucoma. So if you just joined us a little bit past 12 past 2 on Joy 99.7 FM. Last week we started a journey learning about glaucoma. A collection of eye diseases that affect the optic nerve, causing progressive, irreversible damage. I brought you the top of the, pick of the pile. My specialists in the studio still say there is no cure. Ghana ranks second globally. Continentally, we are number 1 for glaucoma. And it is an irreversible cause of blindness. Ladies, you're most welcome. Oops, I'm losing it. Right. Just say that again. Just get your levels.
Thank you very much, Nortey.
Yeah. Vera and Jifa Bella, doctors, ophthalmologists, specialist pediatric ophthalmologists. They're reminding me that last week we didn't talk too much about the kids. So we'll try and stick that in. Most of the stuff we've covered, we'll try and do a quick recap, right? And a few other eye-related eye health issues, we can bring them in. Okay, I remember was it yesterday or 2 days ago, I was telling Jifa that some of their flyers are not eye friendly. Or maybe my eyes need checking. You guys need to think of us when you're putting out your information. We know you will help us when we have problems, but Charlie, try. We
wanted to tease you so you can come for screening, but forgive us.
Yes, when I go for the eye test and all that, and they are doing my central vision, and then they are reducing the size, I'm like, I passed the first 3, leave me now. And then they'll change the lens on one eye and the other one, and they are still making the things smaller. What at all do I want to see at my age? But you're welcome. We're having you again because we acknowledge and we want to underscore and emphasize the seriousness of glaucoma as a challenge. But Bella, you're president. Hit that again. How serious is it? And then give us a sense of the response of Ghanaians each time we do this and over the years.
Okay, so thank you very much, Nortey, and a good afternoon to your listeners. So last week we did talk about the fact that it causes permanent blindness. Right. Sometimes maybe the irreversible doesn't sink down well. So permanent blindness. So the blindness cannot be recovered. It cannot be cured through surgery or glasses or eye drops once it has happened.
Right.
And we spoke about the fact that there are no causes per se, but rather risk factors.
Okay.
And then we said one of the risk factors was most of the risk factors were not modifiable. You couldn't do anything about them.
You have a risk factor, you have it.
You have it. Like you're growing, increasing age, you are black, you have a family history of glaucoma, and then you have certain lifestyle diseases like diabetes and hypertension. It can increase your risk, or you're nearsighted, so you need to wear glasses to see things that are far. Those are some of the risk factors. We said the only one that could be modifiable was the increased intraocular pressure, which we said is the pressure in the eye and is different from the blood pressure.
We can do something about.
We can do something about.
But it will not reverse the damage if it's already occurred.
Yes, so it will not restore your sight. It will preserve the vision you have at that time.
Right.
And then prevents further damage. And that is what glaucoma treatment is about. We spoke about the fact that we have medications, we have surgery, and then we have some specific type of laser eye surgeries also that you could use to reduce the intraocular pressure so that the disease does not progress. To arrest the disease, so to speak.
Great stuff.
Yes.
Okay. Now, let me just seek clarification from you, Vera. She mentioned if you are nearsighted as one of the risk factors that we look at, right? And then that means that what? For a lot of people, when they hear nearsighted, and short-sighted. When you're nearsighted and say what you're better able to see things when they are where?
Near.
Yes. So
When they are near.
yes, as the name implies, once you are nearsighted,
Okay.
you're able to see objects that are close to you, but it's difficult to see clearly objects that are at a distance.
Okay.
So that's what we call nearsightedness or myopia.
Myopia.
Yes. Then
Right.
for those who are far-sighted or long-sighted or what we call hyperopia,
Right.
they are able to see things that are far off, but when objects are close to them, they become blurry.
Okay.
Yes, so that's the difference.
Nearsighted, short-sighted
Yes. Or
are the same.
myopia.
They're the same.
Nearsightedness, short-sightedness, myopia.
Okay. So all of you TV people who've been worrying me, okay. I've asked as if it's my problem. Okay, I understand, but I guess I represent you here. So let's get it clear, right? If you hear nearsighted, short-sighted, myopic,
Yes.
right, or myopia,
Yes.
then we're talking about you, all right? Or that's what we're talking about. Okay, having cleared that, those are risk factors, right? We mentioned that it is irreversible, okay, and then we distinguished it from cataract.
Exactly.
Can we do that again, Vera?
So when we talk about cataract and glaucoma, the first thing is that the two diseases are affecting different parts of the eye.
Okay.
So cataract affects the lens. Now the lens is a structure in the eye, just like you have a lens in your camera, your phone, whichever device you use to capture photographs.
Right.
Now the lens focuses light from objects that we see onto the film at the back of the eye that we call the retina.
Okay.
Okay, just like it works in a camera.
Okay.
Now this lens is supposed to be transparent so that it's able to transmit the light through the eye. As you age, or sometimes due to injury to the eye, or sometimes in children, you can have it following infections, malformations during the process of development.
Okay.
The lens can become cloudy
Okay.
or whitish,
Right.
or discolored, and that is what we call a cataract.
Okay.
And so when you have a cataract, the treatment is removal of the natural lens and replacing it with an artificial lens, which will be transparent.
Right.
Glaucoma, as we have defined, affects the nerve.
The nerve.
Yes, the optic nerve, which is
Right.
like the cable that connects the eyeball to the brain.
To the brain.
Exactly.
Okay. So when you do this intervention and you should I say fit me with an artificial lens, would that reverse my visual impairment?
Absolutely.
Absolutely.
Yes, it reverses your visual impairment.
You know, politicians don't like clear words like that.
Okay.
Emphatic.
Okay.
Absolutely.
So
No. Relax. I like the emphasis, or you are very emphatic.
Yeah.
It will absolutely reverse whatever challenge you had
Yes.
due to
Yes.
cataract.
There's a caveat.
Okay.
Now, it corrects. So there are different types of intraocular lenses that we
Okay.
put in the eye.
All right.
For most of the ones that we have in country, they correct just the distance vision. So it helps you to see things that are
Far
like
away.
far off. But when they are close,
Okay.
you know, the natural lens is able to change power
Right.
by changing its shape. The artificial lens
God at work.
is fixed. Exactly. It's a fixed
Okay.
it's a fixed power.
Right.
And so to see close, you have to increase your lens power.
Okay.
The artificial lens we put in is not able to do that.
Okay.
It's only able to help you see things that are far off and
Right.
you are happy.
Okay.
But for near viewing, then you would need some more lens power. And
Okay.
so we give bifocal or progressive lenses to help with
Right.
reading and all forms of near work.
Okay.
Yes.
All right. Folks, if you just joined us, 21 minutes past the hour of 2 already. We're recapping on glaucoma with our guest from the Ophthalmology Society of Ghana, President Dr. Jifabella Oforiaje. Today, I didn't bring it Oforiata. Right. And Dr. Vera Bayu. Right, both are pediatric ophthalmologists. We're going through the basics for glaucoma. We'll chuck in a lot of other stuff, and then I'll activate the phone line so you can ask your own questions. All right, you mentioned also injury and aging and many other things. We have something we call age-related macular degeneration, right? AMD. But let me, before we get to that one, so can glaucoma just, is it just because I'm getting older? You mentioned it as something you don't modify. You can't modify. But should my eyes just, should I say, deteriorate over time with age? Because there are some people who are quite okay.
Yes. So you remember we spoke about wrinkles last week, and you were fast to say you don't develop wrinkles. So there are some people like you who don't develop wrinkles.
I'm going to make people start checking my face.
So there's some people like me who develop wrinkles. So it's the same with cataract. So most of the time, as you age, the lens will lose its ability to become flexible. But in some few people it may be delayed, right? And then sometimes to certain diseases like diabetes can increase the age at which you get cataracts, because when your sugars are not well controlled, it keeps fluctuating, then the lens will swell up, reduce, and that activity may cause early aging in the lens. And there are other diseases as well that may predispose you to developing cataracts. But most of the time people will develop cataracts. Now the extent of the cataract is what defines whether it is there or not, because someone who does very fine work may have cataract, but will have some form of visual impairment with the cataract, and we want it taken out. However, if I'm someone who just watches TV at the age of 70 and I'm not doing much, I may have cataract, yet it will not affect my activities of daily living. So then I may not want to take out my cataract. But invariably, there will be lens changes in all of us as we grow. And then that will result in cataract. And that is why after the age of 40, you have to push things far. You are not able to read things that are close, and one will have to push objects far away because the legs can or you have to increase the font size
and all that.
Yes, I have
rather than having your eyes checked, you are doing the manual adjustment yourself. Your eye is supposed to naturally do that. Right.
But as you age, then that ability goes down because the lens is no longer flexible. I've had friends who have said toffee aqua and all that too. The aging of the lens, but it's something that is one of the processes of aging of the lens. So invariably, we will all develop cataract. But the good thing, like Vera said, is that cataract can be treated. So it doesn't cause permanent visual loss. It's the leading cause of blindness. Not irreversible, just blindness. And it can be cured through surgery.
Right. My specialist always make things sound so simple and la-di-da. I mean, just go in there, you pop in and out and we're done and you got your vision back and so on. But many people, because of anxiety, ignorance, and many other things, will not get to you. That's why we try to explain and clarify these things. There is help available. There are trained professionals available, and therefore we encourage you to seek the appropriate consultation with the professionals with the requisite expertise. Right? Okay. If you have any questions, concerns, WhatsApp is 055 1111 997. We're live on Facebook, YouTube, and X. This is Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05 on Joy 99.7 FM. We're extending our discussion on glaucoma and some related eye health issues and conditions or diseases. My docs will advise me appropriately. If you have any questions, concerns, share them. All right. I mentioned age-related macular degeneration. All right. That sounds more specific. Yeah. What's that?
So it's age-related macular degeneration, AMD for short, affects the film, the photosensitive film at the back of the eye.
Closer to you.
So it affects the photosensitive film at the back of the eye that we call the retina. So it's the retina that receives the light that is transmitted from the object through the lens, and then gets it focused on its surface for us to form an image. And then the brain interprets these images that we are seeing. Now, in some people, as they age, there is a layer of this retina that is supposed to help in excreting the waste products that are produced in this layer. as they age, this function reduces.
Right.
And then you have, once you have abnormal metabolism or abnormal removal of waste substances, then it accumulates and then it damages the retina.
Okay.
And so they have problems with both distance and near vision.
Right.
They have what we call, they have blots or spots of darkness in their vision. We
Okay.
call that scotomas.
Right.
Okay, and in some cases can lead to blindness.
Okay.
Unfortunately, like glaucoma, it doesn't have a cure for now. Maybe in the future. Early detection, there are some treatments that are available, but in a lot of cases, lifestyle modification, low vision aids are helpful.
Okay.
To assist our patients cope with normal daily living.
Okay. All right, 28 minutes past the hour of 2. Joy 99.7 FM with me, Nortey by nature. I'm in the studio making eye contact with the eye specialist in the studio. We're talking about glaucoma, but we've expanded the spectrum so that we can accommodate and take on board many of your issues. It's not often I get them in the studio and keep them captive for you. Let me activate the phone lines quickly. 030-221-6541, 030-221-221-6541. I know you tell me to slow down, right? You can ask the questions yourself. But let's come back to some of these issues. We mentioned last week that if you're going to have problems with your eyes, even glaucoma, it is possible for it to be one eye, whilst the other eye is kind of okay. Is that right?
Yes.
So you can have left or right.
Yes. So we say it's asymmetric, right?
Asymmetric.
Yes.
Right.
So usually it will be bilateral.
Okay.
But the progression may not be the same. So one eye may be progressing more than the other. That is why people would not notice it and when it's only in one eye until the vision in that eye is gone completely.
Okay.
And I told you a story about that little boy. And so children can also have glaucoma. Okay. We have what we call the congenital glaucoma, where the child is born with it. And we described what happens in glaucoma. We said there's a fluid build up because there's a sieve that the fluid must pass through.
Right.
That sieve becomes a little clogged. In those children, they are born with a defective sieve.
Okay.
So the sieve structurally has a problem. So causes the fluid to accumulate. Now, from birth up until 2 years of age, the eye keeps growing.
Okay.
So when a child is born, the size of the child's eye is not the normal adult size.
Right.
So at 2 years, the child's eye attains the normal eye size. Okay. Now, so from birth till 2 years, when there is glaucoma and the pressure builds up, the eyeball begins to enlarge. Okay, because it's still elastic.
Right.
So the eyeball begins to enlarge. The entire eyeball, the white part, which is called the sclera, begins to enlarge. So the eyeball itself begins to get bigger. Now the clear part of the eye, what we call the cornea, because there's nothing restricting it from not moving, like the sides of the eye, the walls, the sides of the eye have got bones in them.
Right.
So they sort of restrict the eye size a bit, but the front there's nothing. So the white part of the clear part of that begins to grow big. Okay, and that part is called the cornea. So they develop what we call megalocornea. So the eyeball becomes big.
Right.
So in these children, their symptoms include excessive tearing.
Right.
Okay, and then frequent blinking of the eyes.
Okay.
And then when the pressure becomes high, the clear part of the eye, which is supposed to be transparent, becomes a little whitish.
Okay.
So you remember we said glaucoma is asymptomatic.
Right.
But in children, it tends to have some signs and then symptoms. It gives you some telltale signs.
Right.
And the eyeball becomes big. And that's what we say, that sometimes parents notice it, but they think big eyes are beautiful. So they don't seek help. So if you have a child whose eyes is you think it's abnormally large, okay, sometimes the parents have got large eyes, so you see the mother's eyes, there's no doubt about it. But if the child has got an abnormally large eyes and the child is tearing, it's light sensitive, doesn't want to look at the light, these are some of the things that you need to come see an eye doctor so that we check your child for glaucoma. And because it's a structural damage, is a structure the structure that is defective, then it has to be surgically managed.
Right.
So in children, we do not manage with eye drops.
Okay.
So in children, you have to do surgery to sort of clear the sieve and create another pathway for the fluid to flow, so the pressure is down, so that the optic nerve does not get damaged.
Okay.
In the same vein, in children who are older than 2 years, they may also have glaucoma, but in this case, the eyeball doesn't become big because it's done growing. So it looks like the adults glaucoma, where there are no signs and symptoms. And children too will need surgery. Okay, so after 2 years, you need surgery to control your eye pressures and not eye drops.
Okay.
Yes.
Right. I'm tempted to say, I hear you. I hear you. Or the speaker will say, the eyes have it. Yeah. If you've just joined us, it's Ultimate Health on Joy 99.7 FM. We're talking about eye health, eye care, but we're focusing on glaucoma with our guests who are eye specialists, if I can call them that, Dr. Vera Bayo and Dr. Jifabella Ofurie J. If you have any questions, concerns, phone line 030-221-6541. We're live on Facebook, YouTube, and X. My name is Nortey by nature. They're getting me worried about my eyes. I have so many things I want to fire at them. For example, when they say corrective lenses, and we are hearing some of the things that cannot be corrected and all this kind of stuff. We take them generally, but by and large, they are dealing with specific problems. So you may be wearing corrective lenses, but they are correcting something else different from what we're talking about. I have a caller on the line. Hello, good afternoon.
Good afternoon, Nortey.
Hi, who am I speaking to?
This is Dennis.
Dennis. Bennett. Okay, go ahead, please, Bennett.
I had this problem for the past 20 years now. And then I speak to you now, I'm blind, totally blind. And then I don't know. But all this what I've been thinking that maybe there will be a cure. So I'm very surprised, from the resource person that for now there is no cure. And then I don't know whether it's also genetic, because if I say that it's genetic, it's hereditary. I don't know whether that is a fact. But I'm going to pray that Elon Musk has come up with how they call it a kind of device for people who are blind. I'm just praying that that device will work, and then we'll be able to have access to it and maybe see a little bit. So I went off when I was at age 29, 30 years or so. But then I didn't know that I was going blind. It took me about 5 to 4 years before I realized, not knowing I've already gone blind in the left eye. So when I went to the hospital, they told me that, I'm blind in the left eye. But gradually, it was kind of like affecting the right eye. Then the right eye started deteriorating. In about 2 years' time, I went off, and I had no option. Then I go to school for the blind, and I go and learn the braille there, and then continue my education, at the College of Education, and then do my degree at UCC.
Right, Bennett. Let me just ask you. So you are talking specifically about glaucoma.
Of course, yes.
Right, and you said you lost your vision totally in the left eye around age 29, 30, and then 2-3 years later you lost the right as well.
Yes, it started with the left one, but I didn't know. I didn't detect it earlier on. So, but when I went to the hospital, I was told that I'm gone. The left one is the left one is not functioning. It's off. And then they started telling me that the right one would need surgical operation. But I was a bit scared. That maybe that want to go also. I was taking drugs like Optimum and then pillow capping. And at a point in time, 2 years time later, it went off. So as I speak to you now, totally blind. In fact, it happened to me 20 years back.
Right. We're grateful you're sharing with us. So you've had to now shift to learning Braille, right? And then using other aids as well. Do you mind sharing with us, how old are you now?
I'm 48.
Right. So what would you say to people who, kind of doubt these things? You've mentioned some medications you chose or opted to use. My docs were listening to you. But what would you say to people who don't take this kind of education seriously? I heard you say that you were hoping beyond hope that there will be or there is a cure, but you are hearing it emphatically here that there is no cure. But what would you say to people listening to us?
Yes, in fact, initially when I started, I was having this kind of mindset. The people are telling me, people are reading so many spiritual connotation into it, that it is spiritual. In fact, I've spent a lot. Across the country, if I could seek for help, I went to fetish priests, see these so-called big time pastors. I was just traveling around the country to see if I get on my side. And then I wasted a lot of money. At a point in time, I went bankrupt because of my site. So I realized that upon further research, I realized that no, this could not be spiritual. This is physical. It is physical. So I have to encourage myself. It was a bit difficult because I was born blind. So for myself, the kind of different it was extremely complex for me to cope with the condition.
Wow.
But I was asked myself that I have to go to the school for the blind, and then, sponsored to the College of Education, and then went to UCC to do my degree.
Wow.
So I'm teaching one of the basic schools in my area. So a lot of people don't know. So the other chance I have, I tell my students that at least they take their eyes to ask me, yeah. At least that will be okay for them, because going blind is not easy at all.
Right.
It's very complex, kind of situation in front of yourself, you go blind.
Right. Lastly, I know I'm using up your units, but Bennett, so you did shift, you did learn and acquire the skills to use Braille and other things, and it sounds like you did finish your education.
Can we get out here?
You were able to continue and finish your education.
Yes, I went to school for the blind to learn the Braille for 6 months, the rehabilitation center. I was rehabilitated for, in fact, it was extremely difficult accepting the fact that I am blind. I didn't accept it initially, but at the point in time I said, no, I have no option. So I learned the Braille for 6 months, and then went to the College of Education. They do diploma in basic education, 3 years. And then from there, I did a top-up at UCC, and a degree in environmental and social studies.
I salute you, my brother. Thanks for sharing. If you can, please hold on the line and give your number to my producer so that we can build some bridges there, right? You can also do some peer education for us. Docs.
Yeah.
I think Bennett's his story is both sad but inspirational.
Inspiring.
And unfortunately, there are lots of Ghanaians in his situation. Remember last week, we said that about a third of patients presenting for and being diagnosed of glaucoma at the time of diagnosis are blind in both eyes, and about half are blind in one eye at the time of diagnosis. So this is a real issue, and really problematic, and that's why we are here doing all this education to get people to be aware about the disease and get screened, especially if you have a risk factor.
Right.
And it's inspirational because despite the fact that he's lost vision in both eyes, he's picked up the pieces
and he's
of
teaching.
his life, and he's doing great things.
Right.
And so kudos to him, and I wish him well.
He mentioned some medications he was using. I don't know whether you recall the names he mentioned, a couple.
It was difficult.
It was to hear. It was
difficult to hear.
Yeah.
But he's also said that he crisscrossed the country.
Yes.
Pastors, prayer camps,
Yes.
and this doesn't sound, should I say, unfamiliar.
No.
Yeah.
Right. When people, the health-seeking behavior of our people does include some of these things. What do you say to that? Many people think we tend to overly project and promote orthodox medicine, but what do you say to this aspect of it?
So I mean, the Bennett story is the essence why we're sitting here right now, educating the public, because you see, we said that in the Western world they'll start screening from 40 years, and we say that the studies we've done shows that we should start from 20 years, and from 20 years we're doing it every 2 years till you're 30, and then after 30 we're doing it every year, because the glaucoma that affects our people is a bit aggressive. It starts earlier and very aggressive. Sometimes you cannot even control it well with the pressures. You may have to be on 1 or 2 or 3 medications to control them, and that is why screening is key.
Okay.
So we owe it to ourselves to get our eyes screened once a year, so
Once
that
a
it will
year,
be
at least.
detected. Yes, so that it can be detected early. When it's detected early, then you can do something about it.
Okay.
You know.
And if you have risk factors, should the once a year be sufficient?
So usually, if you have a risk factor and you go to the hospital, depending on what is seen, they may ask you, "Can I see you in 3 months?
Okay.
Can I see you in 4 months, 6 months?" So depending on what's is seen in the very first visit, these recommendations will be made. You remember last week, one of our colleagues asked about a scan.
Yeah.
So we do all those things to look at the retinal nerve fiber layer. So it's like looking into detail at the nerve.
Right.
Okay. And then based on that, your reviews will be scheduled appropriately.
Okay, great stuff. I have another caller. Hello, good afternoon.
Hello, Nortey. Good afternoon.
Good afternoon. Who am I speaking to?
Oti watching from Tema.
All right, Oti, snappy. Go ahead.
I want to know if I have any issue of my eye, can I go straight to Kolebu, or should I go to like Tema General Hospital before going to Kolebu, or should I go straight to Kolebu?
Okay, right. Kolebu.
Yes.
Where should I be heading if I'm listening to you and I feel or suspect I may have any of the things you're talking about, or maybe I have a couple of the risk factors you've mentioned? Should I go to the top of the referral ladder, which is Kolebu? What is available at the lower tier facilities? That's essentially what he's asking.
So Kolebu is a referral center.
All right.
And so usually you need a referral
To come to Kolebu. Okay.
So you can report to any nearby eye center, and then you'll be assessed.
Okay.
You can actually request for a referral.
Okay. You
to
can
be
ask
seen.
for a
You can
referral.
ask for a referral.
Okay.
If you're right.
Okay.
And the regional hospitals are available. So Bridge Hospital, 37.
Can't I go to a
Legon.
polyclinic?
You can
Can.
a polyclinic
Yes.
as
All right.
well.
Most of the polyclinics
So,
have an eye
yes.
center,
Okay.
an eye clinic attached to.
And they will have an ophthalmologist or an ophthalmic nurse or an optometrist.
Right.
And it's important to ask questions when
Right.
you see your doctor.
Okay.
Don't just take the eye drop. I know sometimes the patient's load is so much that we tend to move quite fast. Okay. But if you do not understand, please ask.
Please ask.
Because sometimes someone says, "I do not have glaucoma," but you see them holding a glaucoma medication.
All right.
So it's important that you ask questions.
Okay.
What is wrong with my eyes?
All right.
And then what is the diagnosis? And what is this eye drop going to do?
Okay.
Is it curing me? Is it managing the condition? So it's
Okay.
important to do
And
that.
last week we underscored and we emphasized that these drops are medicines.
Yes.
Right? There's a proper way to take them, to
Yes.
use them. All right? So don't just be taking these things. Something's gone off here. Uh-oh. Okay. I think I'm still on air. Let me just check. Something's gone off in my headset. I think it's my headset. But you can still hear me.
We can hear.
All right. Okay. So these are medicines. Let's be mindful. Dede in Maryland says retinal detachment. What is it? And can it be cured or managed? A friend was told the other day and had to undergo an emergency surgery. All right. So detachment of the retina.
Yes, so we've already talked about what the retina is. We said it's the photosensitive film at the back of the eye. And when we say retinal detachment, it means that this film has peeled off the eye, or the back of the eye. And yes, it can be cured surgically. It requires surgery.
Okay. All right.
The
Dede
surgery
in
is
Maryland.
available in
Have you
several
lost
centers in Ghana.
audio in my headset? I'll do that. Correct that in a second. This one just says hi. Okay, hi back. Let me try and read one below that. Good afternoon. This is Oye Nafienya. She welcomes me. Oye, thanks. Good afternoon, sir. Kindly ask your team for me if I can see far, but it looks blurred, especially when I stare on my phone for a few minutes. And also when I sleep and wake up without looking on my phone screen, I can see far and clear. Any advice? I'm 39 years old.
Okay, so it can be one of two things. So sometimes if you have you're staring at your phone for a long time or screens, you can it could be from dry eyes. Naturally the eye blinks to kind of spread a tear film over the surface of the eyeball to lubricate it, and that also helps with the clarity of our vision. Now, if you are staring at your phone, staring at a screen, or even staring in a book you're reading, you tend to blink less. You're supposed to blink once every 15 seconds.
Okay.
But you realize that if you are staring, you're not going to be able to blink that frequently.
All right.
And so then the eyeball dries up and then the vision becomes blurry.
Okay.
Then, for his age, 39,
39.
it could also be because of what Dr. Foreje described earlier, what we call presbyopia. As you age, the lens is unable to increase its power for you to view objects that are close to you, like your phone, your book. So you have problems with reading.
Okay.
And so he may need reading glasses.
Okay. How do you reduce pressure? This one says on the eye, right? We've been talking about intraocular pressure, but this one says, how do you reduce pressure on the eye? I'm not too sure whether it's a mistake or the person is referring to something peculiar to their experience.
I'm sure it's pressure in the eye they are referring to.
Okay.
So we spoke about that last week. We said that there are three main ways: medically by using specific eye drops, and then surgically by creating another avenue for the fluid to exit the eye, so that there's no pressure build up. And then thirdly, we said certain types of eye lasers, specific eye lasers that you can use on the eye, also to create an opening to allow the fluid to divert.
Okay, great start. 48 minutes past the hour of 2 on Joy 99.7 FM. I had a detached headphone, not a retina. It's been sorted for a point. At a point, I couldn't hear anything, but we continued. We're still talking about glaucoma with my guests from the Ophthalmology Society of Ghana. Dr. Jifabella Oforeje is the president. Next to her, Dr. Vera Bayo is in charge of continuous professional development and school mistress, making sure that we are enhancing the capacity of the professionals in the spectrum, because you guys did introduce us to a range of eye healthcare professionals, or the eye healthcare team. Right? Yeah. Maybe you could hit on that briefly, just so we know the different
Before
people.
I answer that, I just wanted to, just in case our listener is talking about pressure on the eye, that is eye strain. You know, sometimes some people have pain in the eyes, some tension around the eyeballs. Probably that is what he or she is trying to describe. And that may be from a refractive error, meaning that they probably need glasses, so need to have their eyes checked. Or sometimes they have eye muscle coordination problems. And all those can only be diagnosed once they are seen by an eye specialist. So I'll recommend that they see a specialist. So yes, to the eye care team, we said here that when it comes to eye health, we are a whole team. Because even though the eyeball is such a small, tiny structure.
Hopefully not Man U or Arsenal.
Tiny structure. But it's a very important structure. And very complicated. Small but mighty. And when you look at all the senses of the body, it's the most satisfying of all the senses, vision. And so we have four main cadres of eye care professionals. We have the ophthalmologists, who are medical doctors. They finish medical school, specialize in ophthalmology, and some go on to subspecialize in specific areas. And they manage both medically and surgically all eye conditions or diseases. Then we have the optometrist. They do 6 years of the Doctor of Optometry course, and they specialize in refractive errors, eye muscle balance, and they also manage minor disorders. In fact, in a lot of areas, they are the first point of call. Optometrists, yes.
So they do measurements.
Yes.
But they have broader training as well.
Training,
okay.
yes, more specialized training.
Okay.
So usually when you go to an eye clinic, they will do the refraction, the test for glasses for you, or if you have what we call strabismus,
okay,
eye misalignment.
Right.
I look me, look London.
Look me, look London.
Yes.
You're cross-eyed.
Cross-eyed.
Yeah.
Yes.
All right.
Usually they some of them are specialized to do those measurements as well. They also manage minor eye conditions.
Okay.
Then we have the ophthalmic nurses. These are nurses, those who they've trained as general nurses and then gone on to specialize as ophthalmic nurses.
Okay.
And they also support the eye care team. They're also able to manage minor eye diseases. They do counseling, referrals, and are very important because they are also usually the first point of call for most people presenting with eye conditions.
Right.
Then last but not the least, we have the opticians.
Opticians.
Yes.
Right.
They would usually, so once the optometrist has done his given his prescription, they would cut out, measure and cut out the lens and fit the glasses for you.
All right.
Yeah.
Okay. Great
so
stuff.
this is the eye care team.
The team. When it comes to this league, that's the team.
Yes.
All right. If you have any questions, we're running out of time, but we'll squeeze them in. Blepharospasm.
Blepharospasm.
Right. What is it? People blinking when they don't want to blink, and now it is rapid fire. It becomes socially embarrassing and all that. What is happening to the eye in that instance? Is it related to any of the things we talked about?
So blepharospasm is an involuntary spasm or repetitive movement of the eyelids.
Okay.
In some cases, there's no known cause or no underlying cause. We call it essential blepharospasm.
Okay.
And there's treatment for it.
All right.
In a few cases, there may be underlying problems.
Okay.
Even including some very.
So I'm there. My eye is blinking.
Now that is different from there's also myokemia, which is involuntary
twitching of the
eyelid. That one is usually very common.
All right.
It's in most people it's a sign of stress, poor sleep, tiredness.
All right.
Okay, and so you have a young, healthy male, female.
Okay.
Suddenly you are preparing for an exam. All of a sudden you realize your eyelids are twitching.
Okay.
Please don't blame the witches in your family.
Right.
It's probably just
go and learn.
Yes. And get some sleep.
As for me, I've set my questions. You can twitch all you like.
Yes. So
right.
Yeah.
Anxiety and some of those stress.
Yes,
all right.
Exactly.
But the blepharospasm.
Yes, it's more severe than myokemia.
Okay.
Blepharospasm, in some cases, we have to give Botox injections.
Right.
To stop the spasms.
Yeah.
Okie dokie. Somebody was asking, so when you do the surgical intervention for the children, are you changing the size of the eye? What are you doing to my child's eye?
So for glaucoma, like we said, the surgery is to divert the fluid. We have to divert. But in the children, there's a structural problem too.
Okay.
So we have to create an opening in that sieve first of all. Then after that, we will divert the fluid, and that is basically the difference between the child's eye surgery for glaucoma and then the adults.
Okay.
For the adults, there's no problem with the structure, so you're just diverting the fluid.
Okay.
But for the child, there is a structural problem defect, so you need to open it up. Then after that, you divert the fluid.
Okay.
Yes.
And the eyeball size doesn't change after the surgery.
No, you're not.
So it will still be big.
Size the child had at the time of surgery, it will still be like that.
Yeah.
But thankfully, because the child is growing, a lot of them grow into the eyeball.
All right.
So the size becomes
commensurate with the age.
All right.
Good.
Okay, not as visible.
As visible.
All right, like some of our mates who had big heads when we were in school. Okay, I was going to greet some people, but good afternoon, Nortey. Please, where should I go for screening? Because I am short-sighted. My mom is blind because or due to glaucoma. This is Queen again. Queen, I have to call you, Charlie. We have to talk. All right, but you're quite a loyal listener as well. I've been to the reproductive health center at Kolebu for the screening. The other day, I asked her whether she did the cervical stuff as well.
Okay.
She's waiting for her results. Say, you see, that's why you're a queen. I had another presenter mentioning your name, Charlie, please be loyal to only me. But yes. So
Yes.
she's asking where to go.
So she can go to the Kolebu Polyclinic. I see she went to Kolebu, so she probably lives close by. So the Kolebu Polyclinic is a good place to start.
Okay.
Otherwise, any regional hospital or any major hospital or eye clinic. And when you go, say you want to screen for glaucoma.
All right.
Okay, so you may be changing your glasses. When you finish, I want to screen for glaucoma as well.
Okie
Yes.
dokie. I came across something. It relates not just to glaucoma, but the comprehensive dilated
Fundoscopy. Yes.
yes. The exam.
Yes.
Right.
Yes.
What is it called again? Comprehensive.
Fundoscopy. So comprehensive eye exam. We spoke about it last week, and we
Right.
did say that it's different from going to check your eye for glasses.
That's different from visual acuity.
Yes.
Right.
Visual acuity. So
Right.
in this one, there's a hole in the eye called the pupil. Okay, it is through the pupil that we look to see the optic nerve.
Okay.
Now, because it's a disease of the optic nerve, you want to assess the optic nerve properly. So we put in these eye drops, specific eye drops that causes the pupil to open up more. So
Okay.
we say we are dilating the pupil.
Okay.
And then we can view the optic nerve properly. Look at the retinal nerve fiber layers, look at the way the vessels are, and it gives us a better diagnosis for glaucoma. So really, if you're getting tested for glaucoma, that is one of the tests that has to be done.
Okay.
Your pupils should usually be dilated.
Right.
Another time your pupil will be dilated is when you have diabetes. So because diabetes affects the eye,
Okay.
if you're a diabetic, you need to get your eye screened at least once a year. And when you go for that exam, your eyes will definitely, for diabetes, your eyes have to definitely be dilated,
Okay.
so that we can look at the eye to see whether diabetes has begun to affect the eye, especially when your sugars are not well controlled.
All right, you're hearing this on Ultimate Health Joy 99.7 FM. With me, Nortey by nature. My guest, Dr. Jifa Bella Ofreje, Dr. Vera Bayo. They are specialists, ophthalmologists, and they specialize in pediatric ophthalmology. And they also do surgery as well, don't you?
Yes,
Yeah.
we do.
A lot of surgery.
Charlie, you people, I should fear you. Good afternoon, Nortey. Luckily, I've had the pterygium removed 2 times in the UK, and the second at the Moorfields Eye Hospital using a pioneering operation of grafting, which has left me comfortable for over 10 years. But my last eye test in December last year detected a cataract developing. Just tinted all my glasses to shield me from the sun. Do I need more, perhaps, interventions? Nana on the Spintex Road. Now bring that into plain English for us. Pterygium and
Pterygium.
Pterygium.
Yes. Okay.
Yeah, please, Nana, you're making my eyes water just reading that. But I'm sure it's very important and relevant.
Yeah.
What is Nana sharing with us?
So I think last week we said that pterygium was a growth
Yes.
on the surface of
Yes.
the eye. Quite common.
Mhm.
Number of people have it. And it can be easily removed.
Okay.
So usually when you remove it, you don't want to leave the area. You don't want to leave the area that's that area bare.
Okay.
So we'd put a graft.
Okay.
And sometimes you would take a graft from another part of the eye, just like when we do skin grafts, and then replace the removed tissue. So that is
Right.
what Nana had done.
Okay.
And then about the cataracts and whether he needs to do anything else, it depends on his visual needs.
All right.
So, like Dr. Foreje mentioned, for some cataracts, they
This
are
Nana,
not.
the way she's typed plenty, I think
They-
it's a female.
Some okay.
Maybe. Anyway, that's
All
right.
right.
Yeah.
So some cataracts are not visually significant. So
Okay.
it's there, but it's mild.
All right.
And so if per his or her visual needs, they are comfortable, they don't need to do anything else. The photochromic or tinted glasses that protects from the UV radiation is
Okay.
helpful to slow down progression of the cataract.
All right.
So it depends. If it's visually significant, affecting his or her everyday hobbies, lifestyle, then intervention is required,
All right.
which is surgical.
Okay, I see the person typing, probably to confirm male or female, right? But thanks for sharing. It always, enriches our program
Yes.
and the direction it's taking.
Yeah.
Lastly, we just crossed over and went to extra time. But lastly, when they say corrective lenses, please, Paucho. I don't see again. Because what are you correcting? Because
Yes.
Charlie, it gets to a point, Charlie, look, I wake up, my glasses must be nearby.
Yeah.
If I haven't slept on them and
Broken them.
and
Yeah,
all that.
yeah.
What is a corrective lens? It's correcting the refraction, what is it correcting?
So remember Vera spoke about the function of the lens,
Yeah.
okay? That it can relax and contract. So when you are not able to see objects properly, so if there's a distant object you're not able to see properly, you can be given lenses to correct that so that your distant objects will fall nicely in place.
Okay.
So once you are wearing the glasses, you will be able to see.
Okay.
The same thing applies when you are not able to see near things. Then you
Right.
wear the glasses to correct it.
All right.
Okay.
To do
So
the
you
adjustments
to
for
do
you.
adjustments. What the lens and the cornea are not
So I'm
able to
wearing
do.
progressive, so it's doing all the
So it's doing both distance and near for you.
All right.
Okay. So these lenses correct the vision that comes out of your eye.
Okay.
But you do not correct the eyeball itself.
Okay.
So if you're nearsighted, maybe because your eyeball is too long. So the glasses does not shorten the eyeball. It just makes better what you
So
see.
the numbers and things you see,
Yes, becomes
specifying
better.
The type of lens you are using,
Exactly.
is the degree of correction.
Yes,
that
the
is being
degree of
done.
correction.
But your eye remains.
It remains the same. So
Right.
the glasses will not correct your the defect. It will just make what you see better. Some people say, I was told that I wear glasses for 2 years and I'll stop. Not likely. Sometimes as you age and the eyeball grows, it may change things a bit, and then your power may either increase or decrease. But the glasses in itself will not cure
Right.
the long eyeball or the short eyeball. It just makes your vision corrected.
Right.
It corrects your
But
vision.
nneɛma
yes.
bi wɔ hɔ a wohunu pɛpɛpɛpɛpɛ. Nneɛma bi wɔ hɔ a, with or without your glasses, you see them. We will probably have to bring in the other team members, the defenders, the goalkeepers, and the midfielders of the eye health care team to get to understand contact lenses, this, that, and
Sure.
what are they doing,
Sure.
and then the relationship between hypertension, the diabetes, and we've covered some of that.
Sure.
But it's been awesome having you on a second dose. I'm tempted to think of a third dose, but ladies, I'm most grateful to you and the society and the work you're doing. Day to day. It's not just during the awareness week that you do this, and we're always grateful when we have you. We'll hope and see how we can get some of these things in, should I say, more regular doses, especially when it comes to kids, wearing glasses in school very
Yes.
young and so on and so forth.
Yes.
And they feel a bit uncomfortable.
Yes.
And with you in that area of specialty, I'm sure we'll be able to do a sequence or a series on that as well.
Yeah.
Most grateful President and Chief Examining Officer, Licensing Officer.
Thank you very much,
for
Nortey,
having
for
us.
It's been great having you, and I'm sure my listeners will agree that, hey, Charlie, bring them. But you see, the problem is they say it to all the people I bring. So I don't know what to do. The kidney or the renal week is on as well,
Yes.
and I have to get into that. I promise this year that will help people get pregnant. So Conception 2025, we started that one, so we got a lot on our plate. Ziggy and I
Yes.
will make sure we get those
Yes.
ones done as well.
Yes. Nortey, thank you so much for the work you do. And
trying.
and you when we're explaining things, we just laugh the way you can bring us down, because it's like we're moving on a different
Me and the
frequency.
grassroots man.
Yes, but you bring us down to the
Uh-huh.
level. So thank you so much for what you do for
Right.
health.
Thank you too, and thank you to my producer and my listeners as well. It's still Ghana month. I'll check out with a hey. Onibakisi, other license. I have a license to check out,
Joy 99.7
Stick and stay. Don't go away. Ziggy's coming up with his Sunday grooves, but hey, do get your eyes checked. Okay, get them checked. You heard a listener share with us. He lost his eyesight on one side, a left side, 29:30. I can't imagine what that feels like. I need to do the psychological aspect of visual impairment, right? And what it means to be blind. Stick and stay on Joy 99.7 FM. I'm out.
Joy 99.7 FM.
Ghana really makes good music. You can't go wrong with authentic Ghanaian music, eh? Oh, hit it back, you see. Or dollar